Good morning. It's Wednesday, June 8th, and I'm Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, sitting in for our esteemed Dr. Stites on Open Mics with Dr. Stites. When the boss is away, you know what that means. The infectious disease docs will get to take over the show. And I think that's great, of course, because we certainly, me and my colleague, have passion for infectious disease, and it's the one thing that our human society has been dealing with. It is a constant struggle and a constant war against those microbes. So, however, first we have a very important story. There is a severe shortage of a life-saving dye, but that will soon be over, and we'll tell you about that in a minute. Plus, monkeypox, COVID-19, and bird flu. Three big viruses topping the headlines across the world. We will talk about the latest research and treatments for those as well. And the COVID numbers are inching up a bit as well. We will have the latest numbers coming up in just a few minutes. So make sure to get your questions sent to us on YouTube, Facebook, Twitter, and the Medical News Network, and you can find the links right here on your screen. So anyways, right now the United States is currently experiencing a shortage of the imaging agents used in approximately 50 million exams annually. It's a shortage that has forced many hospitals to delay procedures and ration their limited supply, but that will hopefully soon be over. Dr. Phil Johnson, the chairperson of radiology here at the health system, joins us now to talk about that. So that's good news that the contrast dye shortage will soon be over. What is the timetable for that?
Thanks, Dana. You know, that is good news. And if you recall, this contrast dye shortage was triggered by a COVID-19 lockdown in Shanghai, China, that resulted in temporary closure of GE Healthcare's facility that is the primary producer of contrast dye. This started in April, this lockdown, and it was largely lifted by June. So over the past several weeks, there's been a progressive increase in production of contrast dye from GE Health. And so we're anticipating, in fact, as of this week, we're up to about 100% of normal capacity. However, the challenge is getting the dye across the ocean and into healthcare facilities in the United States. So there's going to be a little bit of a lag there. So we're anticipating that we should be close to normal inventory levels by the end of June, early July.
All right. Yeah, and I think this just points out, again, what we have seen now in the later stages of this early pandemic is, you know, how it was so easy to trip everything up from supply chains to getting those products delivered. But how long do you think it will take us to return to normal?
Well, I think once we get our full inventory of contrast dye, we should be back to normal. There's going to be a little bit of an increase in volume of procedures to catch up to some of the studies that were delayed or postponed. But again, I think we'll be close to normal levels of contrast and normal scanning by July.
And that is definitely good news. I know I have several patients that need those types of CT scans with contrast done as well. So like everything during the pandemic, we have learned a lot. What do we learn from this shortage? And are there any changes that are being made now for future?
Well, I think, Dan, you touched on this a little bit when you talked about the supply chain. I think one of the things that we've realized and learned is the danger of having these large single source contracts for critical supplies.
Yeah.
So moving forward, clearly we need to diversify and expand our sources of critical supplies like contrast dye. I think we also need to look at transportation and to make sure that we've built in some redundancy such that if unforeseen events like a storm shutting down a port, that we have alternatives to getting supplies that we need. And certainly locally, we're shifting from this sort of previous strategy of lean, just-in-time supply chain to stockpiling larger inventories of supplies just to deal with some of the uncertainties around supply chain.
Well, and of course, we here at the health system are centered on patient care and their well-being and their family's well-being. What's the biggest message we want to get out to the patients right now?
Well, I think first and foremost, this was an unexpected challenge, and I think patients should know that hospitals and healthcare providers are working very diligently and thoughtfully to maintain the highest level of care for patients while dealing with this shortage of contrast. I'm sure there's a lot of frustration and stress that patients have been dealing with in terms of having a exam or a procedure delayed, or having the procedure or exam changed, modified, or another exam being done. So certainly we understand that, but I think, again, the good news is that we're expecting this crisis to be over soon, and by early July, 4th of July, we'll have something else to celebrate, and that's sort of the end of the shortage of contrast dye.
All right, well, thank you. And I know you and your colleagues, such as Dr. Ash, have done a great deal to inform us and inform the patients during this shortage and really keep us on the right track to continue to provide the best care for our patients. So thank you very much.
Thanks, Dana.
Okay. All right. Well, for more than 2 years now, although it only feels like 5, we've been bringing you daily updates on all things COVID. And we'll continue to do so, but a lot of infectious diseases have been put on the public's back burner, even though they never went away, and we have seen evidence of this throughout the world. Today, my special guest is Dr. Kellie Wark, my infectious diseases colleague here at the University of Kansas Health System, and we're going to talk about some of the most common diseases that still continue to worry us. First, let's talk about COVID and take a look at our current COVID count as of this morning. Right now, we have seen the number of cases, active infections start to inch up. We were at under 10 in those single digits for the longest time. But right now, we are at 14 active infections, 4 in the ICU, luckily none on the ventilator, and 5 in that recovery period. So I think overall what we have seen is the trend towards a stagnant number of reported cases or slightly decreased. Hospitalizations are up or down. Again, I think we really need to watch the rolling 7 to 10 day average, but overall it is much better than it was, especially during that time of the Delta Omicron surge. So the latest numbers from Mark here in the metro show we had an average of 305 daily new cases in May, and the highest increase day was on May 31st. Average of 55 hospitalizations daily and 2 deaths daily as well. Nationally, news agencies report that this is going to be a mild summer, which we really hope for. And I'm going to tell you what I think, Kellie, and then I want to hear what your predictions are. I think what we have seen really is that we are gaining some sort of more individual immunity, which will help the population. And by what I mean by that is we have seen people who are vaccinated and up to date getting that immune response in the safest manner possible. But we've also seen people that have been vaccinated or infected or vice versa. And of course, I think we probably also know people who have been infected more than once. So with that, we know that we are gaining immunity. Why is that important? To help reduce your chance of going to the hospital. In addition, we know we have those outpatient treatments. Paxlovid is certainly preferred, but we know monoclonal antibodies also work. Those things really help to reduce hospitalization, severe disease, and death, and that's really what we are looking for from vaccination and, of course, those outpatient therapies. I don't know, what are your predictions for the summer?
I mean, anecdotally, I feel like I've noticed with the uptick that more people are starting to wear their masks, and with the cases starting to go down, I do think that it's going to maybe start trending down a bit more. But certainly with the summer and the kind of exhaustion, we see probably a lot more, congregations and people mixing and getting together. So I mean, that's always, a concern that it could start kind of having little upticks as well.
Yeah, absolutely. I mean, I think we've talked about the vaccine. There does offer some protection, mild protection against getting infected, but really what they are for is to help protect you from going to the hospital. That's what we continue to see. We've always said we would like 100% of the patients that were in for COVID-19 to be fully vaccinated and up to date with their vaccine. Why? Because the overall numbers are going to be greatly, greatly reduced, and your chance of making it to the hospital is much better. So other headlines, breaking overnight, it's being called a possible game changer. Moderna has released its results on an updated COVID-19 vaccine. It's made with the Omicron virus spike mRNA, and is said to be a booster shot that should be ready by fall and nearly doubles the antibodies offered by the current vaccine. Pfizer is also testing a similar vaccine. What does this mean for fall in cases with hospitalizations? I think it's too early. I know that we have said they were working on a bivalent vaccine, meaning one of the components of the vaccine is the original spike from their original vaccine, but they are also putting in an Omicron vaccine. Overall, I think we really need to see what happens with our sustained immune response, especially with those T cells. because we know even on Omicron, those T cell epitopes, or those regions that our T cells recognize really to provide protection against severe disease, really have not changed too much. So I think it's very good news, but we really need to see exactly what happens, what the data is, especially pertaining to mortality and severe disease. In addition, the CDC says pharmacies and federal agencies throughout 82 million vaccine doses from December 2020 through mid-May of this year. That amounts to about 11% of the total vaccines the U.S. government distributed. How concerning is that to you?
I mean, I think, especially now where we have had upticks and people are starting to pursue, getting their boosters or re-get vaccinated, that's always a concern, because you want to see that, we continue to have availability. And like we've seen, for instance, with the contrast, you never know where components of that might start to affect our ability to vaccinate and offer vaccines too.
Yeah, I agree. I think it is totally a shame whenever we have vaccines that could be getting into arms that are going unused and unfortunately have to be wasted. So also, does it appear the vaccine for children under 5 will still be available on June 21st? Certainly we know that the committee looking at immunization practices will be meeting to discuss that and evaluate that. I think we are all hoping for the vaccines for those youngest children to be available soon, within the next few weeks. And I think that is more important as we get into now the incoming school year, really to keep kids in school and keep those families healthy. So, while not on the level of COVID-19, monkeypox has spread across the globe out of Africa since March. Again, remember, it is endemic in a few areas in Africa. They, particularly Nigeria, has been dealing with an outbreak since around 2017, where they have seen over 1,200 cases during that time. So the biggest issue here is that it is no longer just in Africa, it has gone global now. Monkeypox symptoms begin as relatively flu-like, but soon expand to the swelling of lymph nodes and rash across the body and face. And it is really that swelling of the lymph nodes that can help distinguish it from some of the other illnesses as well. The CDC raised its alert for monkeypox to level 2 on Monday, recommending that travelers wear masks among doing other health measures as well. And according to the CDC, more than 1,000 confirmed and suspected cases of monkeypox have so far been reported in 29 countries, 12 states in the U.S., and Washington, D.C. So Kelly, how does this spread?
So monkeypox is spread not by monkeys, but it is spread by contact with lesions, rashes, but certainly even respiratory droplets. So similar to what you could get with a viral infection, a COVID infection, you could get exposed to saliva or mucus. And if you get that, then it can turn into this, similarly to this viral infection.
I think that's a great point, not by monkeys. It was originally discovered in monkeys, but we understand that the true host is probably some sort of rodent. Unfortunately, humans and monkeys can be transient hosts. So just as you said, it is spread mostly by close contact. So obviously there have been clusters that they are evaluating for, and when I say they, epidemiologists, the World Health Organization, CDC, a lot of those clusters tend to be in groups of men who have sex with men. Obviously, if you're having sexual contact, that tends to be close contact. So just as you said, we know there can also be some spread on respiratory droplets, larger respiratory droplets, certainly not the spread the way COVID is spread or to that effect. But certainly we know that is one possible way. Medical officials say cases are going undetected because the disease looks different than what's described in the medical textbooks. Can you explain this a little bit?
So within the U.S., many of these cases have been, as you alluded, across men that have sex with men, and so they're presenting with a little bit atypical than the normal rash that you would see or the normal skin lesions that you'd see. And so a lot of people are presenting as if they had like syphilis or, rectal lesions. And so they also aren't having the degree of systemic symptoms. So they're not having as much fevers, they're not having lymph node swelling. And so I think that's probably been what's contributed to a lot of these cases not getting recognized promptly.
Yeah, I would totally agree. I think those are great points. Again, to be clear, anybody can get monkeypox. It is spread through close contact. So anytime you're having those close contact with people, it can also be spread on things like clothing, bedding, blankets. So it is important to understand. And what they have seen is maybe is the presentation a little bit different in that population, and being around, say, the genital area or the anal area, just like you said, it can be confused with other diseases that we will commonly see in our ID and HIV clinic. Also, the U.S. has rolled out about 1,200 vaccines for monkeypox in response to the outbreak. Should people be getting them now as a precaution?
Yeah, so definitely the monkeypox, although it might sound novel and interesting and really deadly, it's really doesn't carry a very, especially this strain that's kind of imported to Europe and the US tends to have a very low mortality rate, and the infection is self-limited. Most people are not going to have any major problems. The rash and the symptoms are going to go away. So there's certainly no need to start thinking about any kind of vaccination or to protect yourself from getting vaccinated.
Yeah, and I would say, a lot of this, we did not see a lot of this disease because of the smallpox vaccination program that was going on throughout the world. Unfortunately, in the United States, we stopped vaccinating against smallpox around 1972. There were still some places that were doing it a little bit after because they weren't up to date on the recommendations. But unfortunately, if you were born after 1972, you probably did not get vaccinated against smallpox. If you did, you probably still have very good immunity against it. But what we have seen since those vaccine programs stopped is that generations after that now have become susceptible to monkeypox, whereas before they were protected. In general, the public does not need new smallpox vaccination. However, me being such a proponent of vaccination, I wouldn't mind getting one. But in the general population, however, the recommendation is not to just vaccinate everybody. They are trying to do ring vaccinations, looking at those close contacts of those patients and vaccinating those people. I think it's another important point that if you are exposed, if you get vaccinated even up to 4 days after exposure, you are still going to get protection against monkeypox. If it's after that, you will probably get some protection, but you will still probably get some disease. Nonetheless, if the recommendations change, we will certainly let you know. So because of this outbreak, officials are turning to contact tracing in the hopes of identifying who is spreading the virus. We stopped doing COVID contact tracing. Is this an effective tool?
So for outbreak response, certainly that's kind of your initial, tool in your toolbox to try and control the outbreak and prevent it from spreading further. So certainly when you get to COVID, where there's so many cases, the point of doing contact tracing really is kind of lost. But when you have very small cases, we're talking only less than a few dozen here in the U.S. So identifying where those people are and then who those people might have been exposed to is really one of the cornerstones of any outbreak response.
Yeah, and I would completely agree. Remember, even if you have contact with a person with monkeypox, if you can get that vaccination within 4 days, you are still going to be protected. Also remember, for SARS-CoV-2 or COVID-19, there were probably 30 to 40% of people who were not having symptoms, so they were out spreading the disease. Now, really, we don't believe that there's any asymptomatic spread of this disease. So if you have symptoms, you are spreading it, much like the original SARS, where they were able to do contact tracing and really keep that outbreak low because you were not spreading the disease until you were symptomatic. So I think those are very good points that you make, Cal. Any reporter questions for today?
Dr. Hawkinson, I do have one.
Yeah.
So it is from Heidi over at Fox 4, and she has a question about the at-home tests that the government sent out. She says they sent them out 6 months ago, so they are about to be expired. Just curious about why they are only good for 6 months. What happens if you use them anyway? Should you rely on those results? And if they are expired, do you just throw them away?
Yeah, I mean, I think those are very good questions. I don't think we know the full answers to that. First of all, what we do know, there was a recent publication, I think it was out of JAMA Open Network, which looked at people who were testing at home during Delta and Omicron, and really they saw that there was a peak sensitivity, so the ability to pick up the infection if you have it, within 4 days, and that only peaked at like 77%. So there is still very good sensitivity, but we know that you probably have to do serial testing for those things. Now, will that contribute to if we are getting to the expiration dates? I think the most up-to-date recommendation is to check that manufacturer's website, because they don't necessarily have all the data too far out for understanding, are the reagents still good within those tests. If you can check the manufacturer's website, they are able to say, if you have this lot number, it is still good until this date. We know that some of those manufacturers have extended those expiration dates. So I think it is on a case-by-case basis, depending on the manufacturer, but you're able to do that to look up to see if those expiration dates are extended.
But if somebody were to use an expired test and it came up negative, but they're still having symptoms, you're going to suggest that they go out and get another test, correct?
100%. I think we have continued to promote the fact that if you are symptomatic and or you know people who have had COVID and been exposed, you probably need that confirmatory PCR test. And so if you can find and get one of those, that is going to be your best bet. Why is that? Especially if you are high risk. If you are testing early, you can get on Paxlovid early. Again, that is one more thing that will help reduce your chance of hospitalization.
I've got a few community questions, Dr. Hawkinson, specifically about monkeypox.
Yeah.
Emily wants to know, does monkeypox tie to other future disease processes like chickenpox and then later getting shingles?
Mm-hmm. You know, I don't think we have any evidence that monkeypox is a latent or can be a latent infection like chickenpox. Again, chickenpox, most people my age or older probably had chickenpox. After my age, you probably got vaccinated. What happens when you get chickenpox is that virus goes and resides in your central nervous system. At that point, then later on, decades down the line, for instance, if you have stress for one reason or another, you can develop shingles. I don't think we have any evidence that there is that type of infection with monkeypox. Just the same as with smallpox, I don't believe there was any evidence of that. Kelly, do you have any idea?
I would say, I would agree, and I think looking to, although smallpox is really not to the degree, or monkeypox is not to the degree of smallpox, that is kind of like its cousin. And so if you were to get smallpox, you would have lifelong immunity if you survive that. So I would kind of think it would be the same for monkeypox, and without any really recurrences, or that seems not to be reported in the literature. So I think, once you've cleared your infection with monkeypox, you're pretty much protected for life.
Yeah, exactly. I don't think there's any evidence of a latent infection like that. And again, they are pox, chickenpox, smallpox, monkeypox. But we have to understand too, people have been either immune to chickenpox because they had it or got vaccinated. We haven't found that there is immune protection from that, as there would be from smallpox survival or smallpox vaccination against monkeypox. So a little bit different, but they are certainly related.
Isaac wants to know if monkeypox is spread through water, and if it is it killed by chlorine?
Yeah, I don't think we have evidence of that. Again, monkeypox is vastly going to be spread by close contact. In that close contact, you can also consider those heavy respiratory droplets, not quite to the extent that SARS-CoV-2 is able to spread through respiratory droplets or aerosols. But really what we are talking about here is that close contact with those infected fluids. And that could be skin to skin. Again, that could be clothing, bedding, things of that nature, not really through water.
And just last question on this topic. Jean wants to know, has the CDC recommended masks on planes to prevent monkeypox spreading?
I think their latest updates do have enhanced precautions, and that is masking. That could not just be masking in planes, but if certainly you are going to be in close contact with people there for an extended period of time, but other places where you may be in close contact as well. And so I think that is part of their enhanced precautions to take, would be masking in those areas where you are close or closer contact with people.
All right, I'll keep monitoring questions. I'll send it back to you for now.
All right. Well, let's continue our conversation now on some of the superbugs that have been overlooked during the pandemic. Let's talk about avian influenza, or the bird flu. There have been outbreaks of disease that have wreaked havoc across Europe and the U.S. this year, with 38 million birds killed in the U.S. so far. Hormel Foods issues a note of caution on bird flu supply chain impact. Again, more supply chain impact. Jenny O turkey store sales volumes are expected to decline approximately 30% in the back half of the year. It sounds like we expect a pain in our pocketbook from chicken and egg prices, but we want to talk about what happens if you eat an infected bird or egg. A couple months ago, there was a reported case of a human catching bird flu. How is bird flu transmitted?
So bird flu is transmitted similarly to what you would think of flu being transmitted. So if you were in contact with any respiratory droplets, saliva, mucus, even the stool of birds or chickens, then that would be how you could potentially get exposed to it. That being said, as you mentioned, there's really to date only been one case within the U.S. that's been diagnosed with this associated bird flu.
Yeah, and I think that's the one thing about influenza viruses is we know there can be other hosts, and within those hosts, such as fowl or birds, we know that you can have recombination events of these influenza viruses. I believe that person that was infected did well. Of course, they were younger, and I think they were working around birds or chickens. We know that in China every year, because there is such a close population to birds and avian species, there are a number or a handful of cases of humans who do get bird flu, but it seems to be more difficult to spread from human to human, so that is good. But we will always keep a watch out for that. So in general, I think we talked about this a little bit. What happens to a human if you get it? Any symptoms?
So yeah, the symptoms are going to be similar to flu, and so that person that did get the avian influenza, as you mentioned, had been exposed to. There's people that go out when there's these outbreaks within the where the poultry is, and so they euthanize all the birds, and so those are going to be the people that are at greatest risk. But certainly, if you are around birds, if you have there's many people that have backyard coops and stuff, and so those are places where the bird flu can congregate, especially as it's spread across the country with other migrating birds. But so this person had very mild illness, and probably the only reason he was even diagnosed is because those people that are killing all those birds or euthanizing all those chickens, they're monitored very closely by their local health department with daily check-ins and stuff. So this person's symptoms were very mild, and I think it was just fatigue. And so in general, your symptoms are going to be fatigue or malaise, maybe a little bit of headache, maybe a little bit of cough or fever. So similar to what you would have with influenza.
Yeah, I mean, I think we've been overall, quote unquote, somewhat lucky as humans as far as really transfer of these avian influenzas to humans. So I think we're continuing to be around these animals that continue to harbor these viruses. So we have to expect that there will probably be more outbreaks or identification of these things in the near future. Also, one of my more interests is tick-borne illness. So tick-borne pathogens can be passed to humans by the bite of infected ticks. Generally, it takes 24 hours or more, probably 48 to 72 hours of a tick feeding before you can get infected. But ticks can be infected with bacteria, viruses, and parasites, and then transfer those onto humans. Some of those common tick-borne diseases here in the metro area are bacterial infections such as Rocky Mountain spotted fever and Ehrlichia. Less commonly known, but certainly reported on, are viruses such as Bourbon viruses and Heartland virus that were really discovered right here around our community. So let's talk about these. Why are those bacteria, and then of course the viruses we mentioned, why are they more common here in the metro area?
Yeah, I mean, so as you mentioned, a lot of the emerging tick-borne infections have been kind of in this region and kind of the northeast, Kansas, and kind of northwest area of Missouri. I think it's, that interface between a lot of a lot of forested area, and people getting out more, and also their animals and dogs, especially sometimes bringing those ticks back into them. But we are seeing more tick-borne diseases, and that's probably partly contributed by the amount of our change in our climate too, is kind of having better kind of facilitating more better environment for ticks to really foster and go, their season is being extended. So it just gives us more opportunity to really get exposed to them.
Yeah, I think you touched on a good point. There was a recent large modeling study, I think it might have been in Nature, that looked at potential outbreaks or zoonoses spillover from animal species to humans. And one of those driving things was climate change, having that increased comfort zone for those organisms, whether it's animals or insects, to be able to move into those other areas, infecting and developing in other populations. I think it's important to note that with the tick-borne bacteria that we see here, like Rocky Mountain spotted fever or Ehrlichia, the one saving grace is that we have a very good treatment that is a generic, well-used treatment that's been around a long time. Of course, for some of the viruses, it's a little bit harder to detect. Again, Heartland virus was detected here around St. Joseph, Missouri. I think Dr. Scott Folk was looking at that and identified that. And then, of course, the Bourbon virus, the first case, was also here at the University of Kansas Health System. So we do have those things around here. They're a little bit harder to diagnose. But we know the best way to prevent is what way?
Certainly when you get back in, from being outdoors, check your skin always, and make sure to remove ticks as soon as possible. But, really trying to prevent those ticks from ever getting attached to you. So if you're outside, wearing white or light colored, especially cotton clothing really seems to reduce the amount of ticks that can attach, and, repellents also, making sure that that's just an extra layer of protection for when you are outdoors.
Yeah, I think, getting that insect repellent, especially with DEET, I believe it's 25%, is going to be your best method of prevention. If you are also out in the sun, wear your sunscreen, put on your sunscreen first, and then your insect repellent. And now, shifting a little bit, there was a recent outbreak of hepatitis A discovered in strawberries. In fact, these strawberries are organic. But what do we know about this outbreak? What exactly is hepatitis A to start?
So hepatitis A is a viral outbreak, a viral infection that affects the liver. And so you would present with symptoms such as yellowing of the skin or eyes, or jaundice. And you could have, like a diarrheal illness or a febrile kind of illness. It is pretty common still in the U.S. And a lot of times it's going to be associated with outbreaks like this, with produce or things that you ingest. So that is going to be frequently where people come into contact with it.
Yeah, absolutely. I would say it's mostly self-limited. Unfortunately, you probably don't develop symptoms till almost 30 days later. But again, prevention. There is a very good vaccine for this. So if you or your family are not up to date with your vaccines, please discuss with your medical provider. There is a vaccine that protects against both hepatitis A and hepatitis B. Both these are very important to stay up to date with. So the company Urban Remedy not only is recalling the strawberries, but the products they used were including tea sold in Missouri. Here's the biggest concern people need to know about hepatitis A.
So this current outbreak is associated with strawberries.
Yep.
And so if you, these strawberries were actually already recalled at the end of April, but certainly people may have stored those strawberries, frozen them, and unless you cook that at a high degree, I think over 165 for a minute, then you're not going to kill that virus. So if this contaminated hepatitis A infected strawberries were in the tea, it may be viable for quite a while. So basically just being on alert for strawberries, and certainly this is not, all strawberries. You can go to the CDC
Right.
and it's one specific brand of strawberries. And so if you go out in your garden or, strawberry farms and stuff, really the hepatitis A is not known to be in those areas at this time.
Yeah, no, I completely agree. I think, again, just as you said, hepatitis A is most commonly linked to food. We had that question about monkeypox and water. We know that this can be spread through those things like tea, like food. It is more fecal oral linked to food, but it can also be an STD as well. So again, I think that most of that is due to that close contact and really that fecal oral spread, especially food preparers. We know there have been outbreaks in places where food is served. It's vitally important that those food workers wash their hands well after using the restroom. Just do good hand hygiene as well. So we get asked often if hepatitis A can be cured. Is there a cure for hepatitis A?
So as you mentioned, no, it's self-limited, so there's no cure. But really, the treatment is going to be vaccination to protect yourself. As you mentioned, the hepatitis A vaccine that we've had for over 20 years is very effective and has long-term immunity. So really, that's going to be your best bet for protecting yourself. There's no cure, but if you were exposed to hepatitis A, and you have not been vaccinated, then you would want to get vaccinated. And if you have certain medical conditions or you're immunosuppressed or young kids, then there also is an extra treatment that you can get for immunoglobulin to protect yourself also.
Yeah, I think those are great points too. And I believe childhood vaccination series now includes hepatitis A and hepatitis B as well. So very safe and effective methods to prevent you or your family from getting this. So Jess, do we have any community questions right now?
Yes, we sure do. Lisa wants to know, she was COVID positive on May 29th. She is still testing positive, but she has no symptoms. Now, according to the CDC, she says she can go out into the world after 10 days. Is that correct, or does she need to test negative before she can go maskless?
Yeah, the recommendation, really since early on in the pandemic, is not to retest. So if you have been in those 5 days since symptom onset, you can get back into society. I think it's probably safer to stay more isolated for those 7 to 10 days. But if you go back in after 5 days, it is encouraged to wear a mask. I would not encourage testing again. There is no reason for that. Again, if we go back to the virology of this, what we believe and we have good evidence is that viral stage really lasts for about 10 days. If you've been vaccinated, that viral replication stage is probably even less. But it's really after that first 8 to 10 days that you no longer have active viral replication if you aren't immune compromised, and you can get back out into society. It is not recommended that you test again.
Shirley wants to know, do you need a booster for Hep A or B?
For hepatitis A and hepatitis B, again, hepatitis B is a 3-shot series. Hepatitis A is 2 doses. You shouldn't really need in some cases, you can get a booster a year or more after your initial series, but most people should not need that booster dose.
Gretchen wants to know, for those who were vaccinated against chickenpox and never got it, would they still be able to get shingles someday?
Yeah, Kelly?
I mean, that's an excellent question. Yeah, I mean, there is cases that people do get shingles and even getting, so they get chickenpox occasionally too. It tends to be very, very mild. So yes, it's possible, but it tends to be also that the degree of the infection is much less severe had they been vaccinated.
Yeah, and I think just as you said, Kelly, we have seen those people who have gotten vaccinated, who have gotten shingles later on in life. I don't remember off the top of my head, but I think in general, if you had the infection, the shingles tends to be less severe. But again, still, the vaccine offers great protection. And what I would say for anybody over 50, we now have a great preventative method for shingles itself, and that is the shingles vaccine. There was an earlier generation one out, but now we have a newer generation. It is just a part of the virus, so you are not getting the whole virus, but it provides excellent protection against getting shingles in the future. And if you were over 50, you can go ahead and get that. It is approved for that. So.
Couple
Any
more
more
questions.
Yeah,
just a couple more quick questions. Jean wants to know, is there any negative long-term side effects, either from lessening effectiveness or other health issues by taking multiple boosters?
I don't think that we have seen any adverse events, especially long-term, from taking multiple boosters. We know that there was the story of the guy who I think received 90 doses because he was trying to make fake vaccine cards and sell them. But long-term, so the vaccine hasn't been around that long, but I don't think there are any data signals of long-term adverse events from getting multiple boosters, no. And again, remember, we get certain vaccines yearly, like influenza vaccine. We know that we get some other vaccines on some other scheduled basis as well. Of course, the platforms are different and the vaccines are different, but right now there's no data signal about long-term adverse outcomes or effects from multiple boosters at this point in time.
All right, last question. How did the pandemic of 1918 end, and what will we have to do? What will have to happen for us to go back and live like it was in 2019?
Yeah, I'm not sure what it will be like. I think as time goes on and people get older and generations get older, it will probably become similar to what happened in 1918. If you remember, there was still significant circulation of influenza for approximately 5 years. So again, when we talk about the pandemic, I think we have to understand what country or community are we in, because it's vastly different for us here in the United States, say, compared to some of those other lower resource countries who don't have vaccine immunity. We know that there are a lot of countries where there's seroprevalence, meaning the amount of people that have had the virus is extremely high, such as in South Africa. I heard a comment today that about 98% of people have evidence of infection. They've gained immunity. So I think as time goes on, we will continue to become more normalized to this and maybe getting back to pre-pandemic activities and the way things were. The other thing we have to understand is that people are getting older. Our younger generation are going to be growing up with it, developing an immune response to that. But also, what about pandemic, the way things were? I think what we are also going to see is the effect on the economy and supply chains. Those things are going to be long-lived as well, several years at least. So, things are getting back to normal slowly, but of course we have other countries that can be affected. We know China is extremely affected right now, and that affects, how we live here, how other places live, because of supply chain issues. Overall, I think and believe that as we get to that safer immunity of people being vaccinated and up to date with vaccination or being infected and reinfected, we will gain individual immunity. Hopefully those people we will be able to keep out of the hospital and go about the normal life, but I think that will still be years down the road. 1918 influenza, again, was probably about 5 years in general. I think we are probably, and some of the experts do believe that it will be 5 years until we are fully more back to normal, but it could be some time on that kind of time frame. Do you have any thoughts on that?
I think you summed it up nicely.
Yeah.
It's hard to say. I don't have a good idea how much time it'll be till we're back to baseline. But also an interesting thing about, as you brought up the 1918 Spanish influenza, there's a large thought that actually that did start out in Kansas and Fort Riley. So just an interesting historical fact there too.
Yeah. So hopefully that answered the question.
It did. That's it for today.
All right. Well, thank you for being with us. Again, our passion, infectious disease. We are going to continue to see those with spread through each other, with zoonoses spill over from animal hosts and reservoirs. We know that the pandemic has extremely affected those things, such as other campaigns to help reduce polio around the world, where there are still some wild cases. We know TB efforts have been stagnant as well or reduced because of that. Things will get better. It will take time. Do you have any final thoughts for today?
I just want to give a shout out to Dr. Hawkinson, because while he didn't mention it, but he did mention the Bourbon virus, and he was actually the one that first alerted that virus. So he was kind of one of the initial discoverers of that. What was it, 10 years ago, 13?
It was, no, I'm not that old. I've been practicing that long. I'm not that old. It was
2013.
It was 2014, I think, 2015. Yeah, I mean, it was an unfortunate, very healthy, older person, and came in with certainly what looked like a tick-borne illness based on the history, the labs, the symptoms. But I knew something just wasn't right. We were able to get blood to the CDC to look for actually Heartland virus. They then did their initial analysis and discovered that it was a new virus. So hopefully that will just continue to expand our knowledge about these tick-borne illnesses. But yeah, so well, thank you very much. Mm-hmm. And we'll be working with Kellie. She does a lot of work for KDHE and is very passionate about tick-borne illness as well. And so hopefully we will continue to have more information and keep you protected. Again, the best preventive measure is using that insect repellent when you go out into those places and brush in the outdoors. So thanks for being with us today, and we hope that you found it helpful as you make your summer travel plans. Don't forget, you can watch our shows anytime by logging onto our Facebook page or YouTube channel. We'll be back tomorrow with one of our favorite episodes of the Morning Medical Update. And here's a look at what's coming up Friday. Have a great day.
It's a sea of rainbow in Kansas City as Pride celebrations begin. Tens of thousands of people in the KC Metro identify as LGBTQ+. The health system is recognized as a health equity leader. We'll explain what that means Friday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.